everyone. Welcome to Let's Talk Psychiatry. I'm your host, Dr. Chije, and I'm here to continue the series on dementia. Before we continue, please click the like and subscribe buttons and also the bell icon so you never miss a series coming your way. Now, let's talk dementia due to Alzheimer's disease. What is Alzheimer's disease? Alzheimer's disease is a brain disease that causes the brain to shrink, leading to brain death. This then leads to slow cognition and progressive decline. It is the most common form of dementia, accounting for about 60 to 80% of dementia cases. There are several factors that increases the chance of developing this disease, and these are called risk factors. So common risk factors include old age, hypertension, smoking, obesity, diabetes, atherosclerosis, and genetics. And talking about genetics, Alzheimer's have two forms, the familial and the sporadic. The familial form is an autosomal dominant and is an early onset disease. That means the onset is before 65 years of age. This form is linked to several mutations in genes. The sporadic form is a late onset, beginning people over the age of 65, and these account for about 95% of cases. That means it's more common. This disease, Alzheimer's, is characterized by what we call plaques, tangles, and neuronal loss. A key symptom to Alzheimer's disease is memory loss, which may include difficulty remembering recent events or conversations. This symptom may be noticed by the person or family member. Everyone has some occasional memory lapses, but memory loss associated with Alzheimer's disease persists over time and worsens. People with Alzheimer's may also report that they're repeating statements and questions over and over and over again. They may forget conversations, appointments, or even events. They may misplace items or put things in places they cannot remember. They can also get lost in familiar places. As the disease progresses, they forget names of family members and everyday objects. They will have trouble finding the right words to identify objects or express their thoughts. Alzheimer's disease also causes difficulty in concentrating and thinking, and this makes multitasking so difficult. So it becomes hard to manage finances, balance your checkbooks, or even pay bills on time. With time, persons with Alzheimer's will not be able to make decisions and judgments in everyday activities and situations. For example, a person may make poor choices or wear clothes that are inappropriate for the weather, like wearing a heavy jacket in the hot weather. Activities that require sequential steps such as planning and cooking a meal, playing a favorite game may become a struggle as the disease progresses. Eventually, people with advanced Alzheimer's disease often forget how to perform basic tasks such as dressing and bathing. There may also be changes in personality and behavior, and these changes can cause problems like depression, social withdrawal, mood swings, irritability, aggressiveness, even changes in sleeping habits and delusions, such as the person believing that something has been stolen from them. But let me tell you, there may be some important skills that are preserved for longer periods, even when the symptoms worsen. So preserved skills might include things like maybe listening to music. They may be able to tell stories from a long time ago. They may be able to sing, to dance, to draw, or even color. These skills may be preserved longer because they're kind of controlled by parts of the brain affected later on in the course of the disease. Let me tell you something, that Alzheimer's disease has no cure, but there are medications that are available that may temporarily improve or slow the progression of symptoms and improve the quality of life for the person living with Alzheimer's and for their family members and caregivers. There are a number of conditions, that can cause memory loss or other dementia symptoms. If you are concerned about your memory or other thinking skills, please talk to your doctor for a thorough assessment and a diagnosis. If, on the other hand, you're concerned about a friend or family member, about their thinking skills, your memory, you could talk to them and ask them about going together to a doctor's appointment for diagnosis and treatment. Remember, this is an educational forum to raise awareness for mental health and is not to diagnose or treat any disorders. If you have questions about this topic, you can email me at letstalkpsychiatry@gmail.com. Don't forget to subscribe and join our channel on YouTube, Facebook, and Instagram. As always, take care of your mental health, I remain your favorite psychiatrist. I'll see you in the next series. Bye for now.